All right, I think we'll get started in the effort of time conservation for everybody. So let me just stop sharing. And thank you and welcome to everybody who has joined us for our next edition of HER.Talks. This is volume 3. We're very excited. And we had a ton of signups, so we know that there's going to be people coming in and out. And just for everybody to know, as we go throughout the entire program, certainly feel free to ask questions in the chat. This is a very open and honest discussion of everything. And so, we just want to have like really important discussions. And so, wherever you happen to be, if you're on the East Coast and are having your coffee and afternoon tea, enjoy it. West Coast having lunch, and maybe in Europe having an evening cocktail. Enjoy it. Thanks for joining us from wherever you are. And so we know you've been on a lot of Zooms, and there's always a lot of content out there. So thank you for joining us. I'm Marissa Fayer, the CEO of Her Healthy Q. We are a global social enterprise focused on women's health in developing countries. And so in honor of International Women's Month and last week's celebration of International Women's Day, we thought to speak about women's health equity and equality from these leaders would be really a perfectly important topic right now. And I just wanted to ensure that everyone's on the same page. Let's level set these really different definitions of equality and equity. And so equality is when everybody is literally on the same exact page with resources and opportunities. And equity recognizes that every person or circumstance is different. And so the right and exact resources are allocated to them to create an equal outcome. And so without equity, there can't be a level playing field, which means that there can't be equality. And so we really want authentic discussions here. And so instead of me reading a canned introduction of everybody, I'd like to have the speakers introduce themselves, and so you can get to know them a little bit better. So Donna, you want to start us off, and then Stephanie, and then Mitzi?
Sure. Well, thank you, Marissa. Thank you for everybody for joining in. I'm really honored to be on a panel with such prestigious and trailblazing women in their own right. My background is supply chain with a number of different sectors, but for the intent of the next hour, my pharmaceutical background and my commitment to women and women's empowerment. So 30 years of experience in procurement and supply chain and human rights related issues and diversity. So again, delighted to be here. Thank you for the invite, Marissa.
Hello all, my name is Stephanie Humphrey. I am a former engineer turned media personality and currently a technology contributor for ABC News, author and speaker as well. I'm super happy to be here, super grateful for everybody that has tuned in. I know, we might be all catching a little Zoom fatigue these days, but you tuned in here, so we appreciate that. And I'm just really looking forward to this conversation because I tend to focus on sort of the micro level of technology, how it affects individual consumers and trends and things like that. But to have to sort of pull the camera back a little bit, pull the lens back a little bit, and think about globally how technology affects health, and women's health in particular, has been a really interesting sort of line of research for me in preparation for this talk. And I'm just really excited to hear from my fellow panelists around this issue as well.
Hi, I'm Mitzi Krockover, and again, also delighted to be here with these three incredible women. And I thank you, Marissa, for inviting me. I'm an internist by training and previous practice. I led the creation of the Iris Cantor UCLA Women's Health Center as its founding medical director, and then went on to Humana as vice president of women's health. A few years ago, though, a number of companies that were focusing on women's health actually consulted me for my clinical expertise, and I realized this was the next way to really impact on women's health and to move the needle and drive those important innovations that we need. And so I literally wanted to be invested in this space. So I joined Golden Seeds, which is an angel investment organization that funds early stage women-led companies. So I'm one of the co-chairs of the health sector group, which looks at everything from life science companies all the way to wellness and consumer products in the health space. And obviously my sweet spot is women's health. With respect to health equity and equality, I'm looking forward to this discussion because, I've always been immersed in the differences between women's health and men's health, or women's health and everybody else's health, and the paradigms, if you will. But I never really thought about it in terms of equity and equality. So I thank you for asking that thought-provoking question, because it helped me to reframe some of the things that I have spent a lot of time thinking about.
Yeah, that's great. So we're excited to dive right in. And Stephanie, I'll ask you, even though you said you're, you're super into tech and you want to look at in a different way, I'm going to ask you a tech question though. We've noticed, especially in this past year, how crucial technology is to our lives and how it can bridge gaps. And obviously a lot of the work related to equity and equality is bridging these gaps. So can you maybe just talk us through some of the ways that technology can help women achieve equity here in the US and potentially what that means also throughout the world?
Right, sure. So I was super ignorant of the fact that, it was only 1993 when the FDA said that women could actually participate in clinical trials in this country. I was like, we weren't doing that before. I mean, it just didn't make I sort of, in my research, I get why that exclusion had been made, but it still just didn't make sense that you would exclude half the population from development of life-saving, drugs and techniques and procedures and whatever. So I think the first way that technology can start to close that gap is through data. We just need more data, and the area of data science in particular, I think, can really move that needle as far as bringing in more of that information from women-led trials or trials that include, women's outcomes and things like that. So, firstly, let's get the data going. And then, beyond that, I think, the funding for the technology, that's sort of the second piece of that, because, you have this whole space, this whole new space, this femtech space, if you will, that is still really underserved and underfunded. So if we can get that piece of it in there as well, then I think we're well on our way to closing that gap. But I think the data is the most important piece.
Yeah, and everybody's been using telehealth. So is that something like one of the big trends that you're seeing, especially, in a lot of the work that you do?
Oh, absolutely. Especially now we're all sort of, still quarantining and not able to have those in-person visits. And that's going to be something that we're going to see remain in effect. I don't think, once we all have a shot, a vaccine, that telehealth is going to go away. I think that's going to be something that's going to be still very much a part of overall health. And I think that will also help close that gap as well, because now you have another tool in the toolbox, if you will, that can help get women the care and the information that they need to get that gap closed as well. So yeah, telehealth is going to be huge. Digital connected products will be huge in just monitoring and tracking, again, back to the data, tracking heart rate, tracking blood pressure, tracking diabetes, in addition to women's, reproductive health issues. So we'll see gadgets and devices. We'll see a big surge in data science around, women's health information, and we'll see that telehealth continue to grow.
Yeah, that's really interesting. And so Mitzi, actually, as a physician and an advocate for women's health, like, what are some of the trends that you're seeing related to women's health? And more importantly, are they trending in the right direction? Or have we, as a result of the pandemic, have we kind of slid back down to where we were before? Obviously, we're always hoping for better outcomes. So what have you started to see?
It's always a double-edged sword, right? So in terms of the pandemic, women have really experienced the brunt of the issues. They're more likely to be in as essential employees and certainly healthcare workers. They're also most liable to be managing the household, managing the children. And in fact, what we're seeing in terms of different indices is that mental health issues have increased, stress has increased, the exposure to COVID for them has increased, jobs have been lost, professional pathways have been derailed. In fact, it seems like we've lost a generation of progress. And what that does in terms of health and women's health is that those individuals may lose their health insurance and their family's health insurance, access to care, even social determinants like homelessness and and food insecurity. So those have an impact on women. And then the other piece of the pandemic that is really inequitable in terms of women is intimate partner violence and substance abuse, which sometimes go hand in hand. So these are real issues that we are going to have to address so that that women don't fall through the cracks and that we can get them back on. But on the other side, this has been, all puns intended, a very fertile time for women's health innovation. And I think that we've, again, seen a just burgeoning of women's health innovation, mostly led by women, not all, and probably propelled by the pandemic in terms of the need for the remote monitoring and the telehealth, and also the consumer demand in terms of wanting point of care and wanting to be able to go and get over-the-counter medicines or even diagnostics and wanting care when they want it, and also for their families. So those are all good things. And then the third piece, perhaps, is this increase in as Stephanie talked about data, a lot of these companies are generating their own data. So where we did not have answers or information or research, we're actually getting it in real time. And I think that's going to have a lot of positive repercussions for the women's health. And then the other piece is that there's also a growing acknowledgement in this women's health space, both from a practitioner and also from an entrepreneur, is that women's health is more than just reproductive health. So we're seeing focus on aging, menopause, in genital urinary issues, cognition, bone health. Again, we're heart disease, which is one of the, obviously the #1 killer in women. So I am very optimistic. I guess I will just leave it at that.
Well, that's good. And Donna, I wanted to pivot to you on the topic of sustainability and corporations. So, there's a lot that corporations can do to further women's health and also our sustainability that corporations have, but also sustainability for all of our life. And so how are corporations how are they dealing with this? How are they thinking about it? Because it's one thing to, of course, write a check to support, organizations such as our Health EQ or, or other ones that are around, but there's other sustainability that works. And what are corporations thinking about related to this topic, honestly? Sure.
Well, sustainability, and that's why I love my colleagues when they fell back on, the data science, the data analytics. The numbers don't lie. Data drives sustainability, but data also drives innovation and it drives commitment, because if it doesn't get measured, it really doesn't get done. And when you look at whether it be, a healthcare network, because so many of the smaller hospitals are now becoming conglomerates of larger hospitals, and they have much more purchasing power and a much stronger voice in dealing with their suppliers, as well as corporations that provide, whether it be the finished goods or the services to hospitals. But at the end of the day, regardless of the sector you're in, whether it be life sciences or, CPG, corporations, when looking at sustainability, the underpinning of decisions are always the same. It's about coming up with sustainable solutions that are going to bring in cost avoidance, that are going to bring in cost savings, that are going to ensure continuity of supply. When we think about what went on during the pandemic with getting, PPE equipment and states having to negotiate against each other and outbid each other, that continuity of supply was certainly an issue, but also patients, especially in healthcare facilities, they do want to make sure that, you know, hospitals and companies and organizations that are in their community are doing the right thing. And when you look at the numbers now that are being generated, you know, by healthcare facilities, the impact that they have, you know, on the national GOP is staggering. I mean, we're looking at an additional increase of 20% in the healthcare industry by 2026, just on healthcare spending. And when you look at sustainable means within that, it's quite complex, because you can go from one end, you know, to logistics and to energy saving methodologies, to actually, you know, pushing the envelope with suppliers to come into the organization with innovation, with strategies where they can recycle, they can repurpose. There are companies that deal with operating rooms that they do have incentives and rebates for hospitals. So although I believe healthcare facilities and hospitals, of course, want to do the right thing, there's got to be a financial component to it as well. And I think this is the challenge that COVID has brought, because all of a sudden you went from things that were going to be recycled or could get multi-use wear that now had to be disposed of. So companies that are aligned to the sustainability development goals, right now the numbers are saying that this 1 year, corporations took a 5-year step backwards. So lots of challenges, you know, in that space and sustainability, you know, for healthcare, but lots of wonderful opportunities and innovation possibilities.
Donna, that's really staggering that we've taken 5 years step back when we've just really kicked off the SDG, you know, goals, and, you know, just a few years ago, and the fact that 2030 is quickly approaching. And I wonder if there's ways that we can, you know, really exaggerate it in the coming years, and that sustainability could, you know, duplicate itself, and we can kind of try to make up some of those gaps, because that's horrible.
It's almost going to be like a coalition mentality, you know, like the hospitals coming together, you know, and looking at the needs of their own community, but looking at the goals and potentially the cost savings and cost avoidance, because the more they save and the more they avoid, the better care that they can provide, you know, increase staffing, increase, you know, quality and quantity of care. So those cost savings and cost avoidance numbers are incredibly important. When I looked at some data, we're looking for the healthcare industry with taking on sustainability, you know, methodologies of saving $5.4 billion over the next few years. So the data supports innovation, it supports creativity, and it also breeds an environment where hospitals and healthcare facilities can really engage in their communities. That's
incredible. No, that's really incredible. Thanks, Donna. And, you know, something that I think all three of you have touched on is the word femtech and technology. And so Mitzi, you spend obviously a lot of time as an investor, and you're somebody that I for sure look up to as an investor. And so, you know, femtech's this big fun word, and I'm so happy that you said that femtech is not just, you know, what I always say is it's not just one organ. Like women's health is an entire body system, and it's not just one or two organs. And so, you know, but there's a lot of buzz. Everyone's talking about femtech, you know, especially in the investing industry, and it has incredible growth potential. So how can we actually democratize investing into women's health? And it's something that Stephanie touched on, something you touched on, you know, and it dovetails also into a lot of, you know, sustainability. So how can we democratize investing into women's health and almost like make it more popular instead of just a buzzword, because these buzzwords like come and go. And so how can we make this sustainable?
Well, first of all, you know, you've keyed in on one thing. It is a buzzword, and a lot of people, even in the femtech satellite community, really don't like the word. So, you know, let's just talk about what it is. It's women's health, right? And because not all of it's going to be so high touch in terms of tech. Some of it's going to be, you know, programs or product or services and that kind of thing. Obviously, most of it is going to have some kind of technological component. But, you know, it's interesting because if you think about it, it's kind of a no-brainer, right? It's 51% of our population are going to avail themselves of this. It's not niche, right? But unfortunately, even now, most of these companies are women-led, and women-led companies are not getting the funding comparatively as other as companies led by men. It's getting better. There's more organizations such as Golden Seeds focusing specifically on this issue. But when you get into the higher funding categories like VC and private equity, it's just not there. And you'll hear a lot of these entrepreneurs say, I had to pitch my, speculum to, a room full of men, and, they're just not getting it, right? And you can't fault them. But at the same time, so I would suggest that for entrepreneurs, don't try to force it on anyone. There's a lot of other opportunities and ways to do that. And I also think that, again, revenge is the best, success is the best revenge. And so what's going to happen, and we're seeing it, is that these companies are going to start being very successful. And it's going to be, investors want to make money. And so that's what's going to drive this. And what we really need to do, though, as you pointed out, is really get those companies a chance and this early funding. But on the other hand, entrepreneurs really need to dot their I's and cross their T's at the same time, like any other innovation. They've got to really identify a true pain point. And many of them have, and it's usually their own pain point that they're now bringing to the market because others have. And that's what's really great about it. And then they have to have a market, they have to have a revenue stream, a barrier to entry, to deal with the competition, all those kinds of things that any entrepreneur has. But I think that the challenge is just really getting a foot in the door and making the case for why this is important.
Can I add a follow-up to
Yes,
there?
great.
So in the companies that maybe have approached Golden Seeds with these sort of femtech ideas, for lack of a better word, was there any sort of commonality in the storytelling around their pitches that prompted you to invest in them? Just maybe some key something that a founder could take to another, investor and make sure that they included that part of the story or included that into the pitch to be successful with other investors as well.
That's a really great question. And so two things, again, we're usually the demographic. So when someone presents something that has to do with bone health or urinary incontinence or, aging skin, we get it, right?
Right.
Or even so that story resonates with us. We understand that. Or a medical device that's solving a problem. And then as investors, we're still using the same metric. Is this a good idea? Is there a market for this? And so the entrepreneur really has to make those cases just like any other entrepreneur.
Right.
So, again, once getting over the hurdle about what the it is, and making sure people understand why it's important, then everything else has to be as competitive as any other
Right.
company.
That makes sense. Stephanie, is there any tech that you've seen that that really, is standing out for women's health, or ones that could be, widely adopted and might be able to,
I made a list.
equity. Oh, yay! Great. I'm glad we're recording because I want this list.
The one thing that I found, which I thought was really cool, it's a device called Kardia. Kardia spelled with a K, Kardia, and it is a portable personal EKG. So I think about what the Apple Watch can do right now, and the fact that the Apple Watch has, an EKG built in, or the top tier Apple Watch, I'll say, because I have the SE that does not have that. But it costs $400 plus, and that is definitely, cost is always going to be a barrier to entry for anybody, especially in developing countries. And when you're talking about paying $400 for a smartwatch, Kardia starts at $89. So I just thought that that huge difference in price point would really make that something very attractive to the individual, or, you know, maybe a church could purchase that and have that in place for its congregation, or something like that. Like, you know, it's a lot easier to get together $89 than it is to get together $400. So I did the price point of that particular device, and the ease of use really stood out to me, because it's literally just this little sort of thing, like a rectangle with two metal contacts that you put your finger on, and the app measures measures all the EKG measurements. I'm not a doctor, but it
great.
but it was the price point, the portability, the size, you know, the convenience of that device that really stuck with me. I love Clio, which is getting a lot of traction right now. That whole idea of a family platform. I think we'll probably see a lot more of that, just in terms of companies looking for ways to, number one, add to their benefits packages to make their company more attractive to prospective employees, but to also better manage the employees' health that they do already have, to keep them happy, to keep them there, to keep them productive. You know, it's a win-win on both sides of that. So I thought that idea of sort of family support, a family support platform, if you will, that companies can implement to make sure that the entire family is having their health needs addressed was really interesting as well. You know, you got your Neurexes, you got your Thinks, which, you know, may not seem like a tech product, but is. And I think we're going to start to see a lot more subscription-based technical health related type things that can happen. And that speaks to, you know, COVID and quarantine, but it also speaks to people wanting that convenience and the privacy that, you know, you get when you can get something delivered directly to your home. So I think, you know, it'll be interesting to see how that subscription-based model tracks across different sort of health issues and different types of devices. And then I actually loved Atusa. It's a gadget called Atusa, and then there's another one called no, that was something else. Atusa is from a company called iSono. It is a portable and automated 3D breast scanner, which, you know, I was you know, as I'm thinking back,
yes, we know them. Actually, we know them pretty well.
Yes. Oh, nice. As I'm thinking back to my mammogram, I'm like, man, this would have been so much more convenient and comfortable and easy. So I totally see that. You know, have you guys been able to use that at all in the countries that you serve? Because I mean, it seems just like a total game changer and no brainer for developing countries, especially.
Yeah, it's something that we're looking at. I've spoken to them many times. I actually have one at home as well. I love it.
Awesome.
I was able to kind of trial it out. So it was really, I really liked it. So
yeah, that was great. And then you got, you know, Willow, which is a wearable breast pump, which again, data is a thing. So it's tracking not only, you know, it's not just pumping, it's tracking the amount of fluid. So, you know, infant nutrition and things like that can be tracked and improved in developing countries. And then Breathe ILO is a fertility device that just uses your breath. I mean, you know, I haven't had to go through that process, but, you know, from what I understand, it's incredibly invasive, and you know, that whole idea of trying to conceive can be really fraught for a lot of people, and you know, especially when you don't have thermometers and all the other sort of equipment required to you know, make sure that you're at your most fertile. I thought the idea of just the breath was really interesting and innovative. So I'll be curious to see how that advances as well. But there's so much stuff out there, and you know, as Mitzi said, you know, as folks start to make money, you know, there were a few different exits last year. I think Progeny was probably the most widely known and had the biggest exit. So as people start to make money, we're going to start to see a lot more of these products on the market. My hope, though, is that we won't see the pink tax that typically comes along with it. So hopefully we can have these products at price points that don't penalize us for being women.
No, that's so true.
If I could add, you know, it's interesting. I was just thinking about the question, especially as it deals with developing countries as and technology. You know, a lot of what's happening, especially in women's health, but in general, in commercializing science, if you will, what's been really nice is that there are funders such as the Gates Foundation, such as even NIH with the SBIR grants that are available for those early stage and clinical studies and that kind of thing. And so if there's any entrepreneurs out there, you know, one of the things that we look for that's almost like a validation, if you will, that this is a good idea. And it's also what we call non-dilutive funding. So it means it doesn't take any equity from anybody. And I think that's very promising because we're seeing some, especially in the life sciences, some really important innovations in diagnostics and treatments that I think will be supported in that way.
Yeah, absolutely. And Donna, I'd love to kind of get your thoughts, especially, you know, you work with some of these large corporations and you work with, you know, some of the pharma companies and just, you know, general sustainability. Like, do they even want to hear about femtech? Like, I mean, I'm hoping the answer is yes, but do they want to hear about it? Is it something that's even talked about? Is it, you know, it does have to do a little bit in my mind with sustainability and corporate social responsibility. And so does anybody even talk about this in the corporate world?
Yeah, yes, they actually are. I did want to make a point though, when we were talking about, you know, women entrepreneurs, that there's also some wonderful organizations out there that women entrepreneurs, they can get, you know, certified as, you know, a woman-owned business. That becomes very helpful if companies, you know, or hospitals have any kind of subcontracting plans with the government and their numbers need to be counted. Sometimes that's a make or break decision with regards to what type of service providers, you know, a corporation wants to hire. There is an organization called WeBank, the Women's Business Enterprise National Council. So just wanted to put that out there. Often there's, you know, a need for women to not only align with other women, but to really understand the processes and how RFPs work and so forth and so on. But with regards to your question, and corporations, yes, because corporations obviously have the data, you know, there we go again with the data, but they have the data to support, you know, who needs their scripts, who needs, you know, their therapeutics. You know, if you look at a company like Bristol Myers Squibb, or I was just doing some work with Novo Nordisk, and you look at who their patients are, you know, you're looking at African Americans, you're looking at women, you're looking at Latinos, especially at BMS. You know, at Novo Nordisk, you're looking at, you know, type 1 and type 2 diabetes. So there is not only, you know, an ethical right direction that a corporation needs to go in supporting in their CSR arm, but also ensuring that their technologies and their scripts do get to third world countries. You know, if you go back in, you know, the beginning of the AIDS day, when there was so little known about AIDS, the company I worked for at the time, BMS, was the largest drug contributor to AIDS medicine in West Africa. And to be honest with you, that was actually the forefront of changing CSR from just philanthropy into a much more focused, much more deliberate effort, and expanding that umbrella into sustainability and human rights. And underneath that, you know, framework of human rights is access to medicine, access to education, you know, fair and equal pay, discrimination against women. So it was really, you know, from a philanthropic arm that corporations then started to evolve into the CSR as we know today. But to answer to your question, absolutely positively, yes, are companies looking at women's health, especially companies that have a direct impact on it, both on their bottom line, as well as their innovation and the direction they want to head in.
Yeah, that's really amazing to hear, quite honestly. And so I think that's probably one of the biggest ways that we're going to be all together be able to achieve equity, is with these companies really working together with us in communities that they probably weren't thinking about 10, 20, 30 years ago. And that's how we're going to probably, you know, that's how I know we're going to achieve equity in our own country and also all throughout the world. Now,
I just want to add something to that. It really becomes for a corporation very cross-functional, right? Because you're looking at R&D, you're looking at corporate affairs, you're looking at your legal groups, you're looking at supply chain, you're looking at governments in other countries. Because at the end of the day, both sides of the table have got to answer the question, what's in it for them? What are the advantages for the governments of these countries to engage with the multinational to bring healthcare, right? All this preventive maintenance and bring education. You're infusing the opportunity for women to be bigger contributors to society. So that connection as well, cross-functionally, internally in a corporation, along with the government in those countries, is critically important.
yeah, that's really great. I'm going to encourage anybody who's listening, if they have any questions, write them in the chat. It's like a chat with my friends over here, but I'm going to let everybody else have some opportunity to ask some questions. So if you guys have questions of each other, I know that you've thought of a few. Feel free to ask each other. We have probably about 10, 12 minutes left of this chat, to just be respectful of everybody's time. So who wants to ask each other some questions? This is the fun part.
I actually have a question for both Donna and for Stephanie, so I'll start with one and go to the other.
Sure.
Stephanie, one of the issues with any kind of digital technology is the user experience and, how to engage, and especially in health. You've got two customers. You've got the customer who's actually using the technology, and you've got the person who's paying for it. And the payer wants to know that the customer that's using it is going to use it and engage in it so that they can reap the benefits. Mm-hmm. So what are your thoughts in terms of maybe if somebody's developing that technology for women, or if a woman is thinking about using it, what are some of the important things that you've seen?
Well, it depends on whether we're talking globally or domestically, developing countries or not, because I think internet access is going to be the most important thing. So whether or not that primary customer has access to the internet is critical, because that's going to determine the type of product you can develop. I mean, there are still some things I think you can do around SMS text message chat bots and different things like that that don't require necessarily internet access to do. You also need to think about if it's a device, how it will be charged. So maybe building in some sort of solar power capabilities will be necessary for, a Fitbit or something that will track blood pressure and monitoring, something like that, some sort of bracelet style situation that still could be used in a developing country if it had a way to be charged. So, the mechanics, if you will, of the thing, I think, user experience is this nebulous sort of concept that, is secondary only to functionality and usability and what makes sense in the space where you're trying to push the product. So I would think about what sort of internet access that primary customer is going to have, and then device wise, whether or not that device will need to be charged, and how do you solve for that problem, because it could be just a matter of movement is something that charges it. We have watches that run on our own wrist movement. So, maybe that's how you get the power to the device or things like that. So, those two things I think are the key considerations, before you kind of get into who's using it and how they're going to use it. It doesn't make sense for the particular audience.
That's so simply elegant, but so important. Thank you.
Mitzi, just building off of that, I mean, with regards to the, the technology, the infrastructure, and, the potential impact to the infrastructure, of a country is just mind-blowing, to do that. But then that opens a Pandora's box of other issues as well, right? Because you have to have people there educating people on how to use the technology, the whys, and the, if you use it, here could be some of the results. So some of that, but when you look at some of the successes, you know, on what the world has done with just even regards to clean drinking water, you know, tablets that were created that you can, you know, turn, you know, drinking water that's not fit for human consumption, you know, into drinkable water, and the impact of water. You know, in certain countries where I've been involved in projects, you know, just bringing in solar handheld lights that are good for 12 hours impacted villages of women to be able to congregate in the center of their village so that they can do just what we're talking, like just shooting the breeze about how crappy their day was or how good their day was, or, you know, can you help me with this? All because of a solar panel light. And what doors that opened? That opened doors for teenage girls to go to school so that if they had chores to do and they could come home with these lights, the reduction of personal violence against them because now they had a light. So, you know, the opportunity for technology to make a difference and just, you know, almost begin to part the seas for young women, you know, and adult women is just phenomenal.
Yeah.
We're very excited about that, as you can tell.
Yeah, I mean, when I'm traveling, I carry, you know, 2 solar chargers, and, you know, that's what's charging. And this is like when I go to Africa and Latin America, I mean, that's what's oftentimes charging their phones, you know, the solar lights. And so there's tons of them. There's even like a soccer ball that you can, you know,
I was going to say, I've seen that.
Yeah, from Jessica Powers. Yeah, it's great. It's you know, you kick a soccer ball, it builds up all this kinetic energy. It's like your power source for the night. You know, so the kids are already kicking the soccer ball. So, you know, you might as well use it for something else. And so, but yeah, I mean, solar charging is the way to go. And you know, there's access from what I've seen. There's so much access. There's a lot more. It's not everywhere, but there's a lot more access to power. I actually have better internet in Africa than I do in New York City half the time. So let me put that out there. So and I think that's becoming a lot more pervasive, and the fact that, like you were saying, like maybe it's movement based, maybe it's, you know, soccer ball based, maybe it's solar based. I think there's probably a lot of opportunities to utilize what we have naturally. Again, points again to sustainability too, on how to utilize this for health.
I like the idea about the soccer ball because you could get in your exercise and also charge your device.
Right.
Yeah, way to talk about health always. Perfect.
Absolutely.
Does it give you any kind of competitive advantage that the ball will go faster or something?
I don't know. We're gonna have to look into it.
So Donna, I had a question in terms of, again, thinking about, you know, again, entrepreneurs, and, you know, they're so focused on, you know, getting costs down and making revenue and all of that, so that sustainability may or may not be even in the equation. So are you seeing any kind of focus with respect to providers that are perhaps starting to choose more sustainable products over non-sustainable? And do you ever see that happening in a way that they're choosing it just as consumers are now choosing more sustainable products?
Mm-hmm. You know, to be honest, you know, with you, it really comes from the helm, you know, of the organization and the key decision makers, because sometimes these cost savings or the impact on a sustainable, you know, decision is not immediate, right? So the ROI might be 2 years, might be 3 years. And, you know, it truly does depend on the business imperative, you know, and the space in which they sit, especially in a CPG company, right? Where the numbers and where the sustainability, you know, results are quite public. They have sustainability reports. They have shareholders that have a, you know, a distinct agenda around sustainability. So again, where it's that, you know, where it gets measured, it will be done. You know, if you have visionary key decision makers that are willing to make the investment, but know that they might be putting out more than they're getting back, you know, in the short term, but in the longer term, their commitment to climate change or their commitment to, you know, greenhouse gas emissions can be really impactful, but not necessarily immediately. So yes, I do see decisions being shifted in that direction. sometimes from peer pressure as well, right? So if Nike's doing it, you can rest assured that soon Adidas and Puma and New Balance are all going to be doing it. It's no different in any sector. But my personal opinion is that sustainability by default has got to become even a bigger issue in the healthcare area, because there's too much innovation out there that is needed. There is a tremendous opportunity for cost savings, and there is a tremendous opportunity to have a measurable impact in the world.
Absolutely. I mean, the irony, right, is that it has a direct impact on health.
Exactly. 100%. Yes.
Yeah, for sure. So I think we have time for one more question. Who wants to give that one?
Well, I'd like to ask you a question, Marissa.
Oh, forget it. We're out of time. Just kidding.
Oh, look at the time.
Yeah.
So you talked about the need for equality to get to equity. And, I think just by default, that means that some communities will have to be better resourced or more resourced than others to fill in that gap and get everybody up to some level of parity. Has that been a challenge for you with your fundraisers and your charitable partners? And if so, how are you addressing those concerns when people say, well, why did this community get more money than that community? And it's like you're explaining this thing over and over and over again, but how are you addressing that?
No, it's a really great question. And it's one that we get often, because a lot of people, and we've seen it especially with, in respect to COVID-19, and something that we've known as an organization for a long time, but there are inequities in our own country.
Yes.
And within, I live in New York City, within our own city, there's huge inequities, and we've known it. And now kind of everybody else gets to see it in light, specifically in COVID-19. And so, we always get asked why we're not doing work in the US or in Europe or in, what are considered first world countries and very developed countries. And it's not that we're not. We actually did just recently contribute to a program in Mississippi focused on women's health, and has a mobile van and drives around. And it's wonderful to get to other communities. I think in the great majority of equity and equality, we have access in the US. We have better infrastructure, such as roads, such as buses, whether trains, or, there is more internet access. And I don't want to say that forever, because there's absolutely parts of this entire country that do not have that. But if you look at the country as a whole versus other countries that are in the developing world, they don't have that. And so the other thing that we focus on is making sure that women have access. So again, while our laws in the United States are not perfect, nor in Europe, they are far better and equitable than so many other countries. And so we want to make sure that there's access to equipment and access to healthcare services, just like we're talking basics. We're talking about maternal health. We're talking about just cancer detection. We check for cancer once a year, once every 2 years, and we're grateful to be able to do that here. They're getting, people in developing countries, especially women, they're lucky if they get checked once in their lifetime.
Right.
And so it's really comes down to access. And in order to even get close to a level playing field where other developing countries can be checked, let's just, say it for how it is. Even once every 5 years would be better. 10 years is better than once in a lifetime. And so we just want to give them the opportunity to do that. And for us, we want these countries to get to the level playing field where we are. And also, when you have healthy women, you also have educated girls, because the girls are able to go to school. And from my perspective personally, it's those girls that are going to literally change all of our lives. They're going to be the Nobel Prize winners. They're going to be the next game changers, the next entrepreneurs, the next inventors. And they're going to be helping their own communities too, and their own countries, that for things that we can't even imagine. When I first started traveling, these are things I never even thought about. And when I talk about them, people just kind of are shocked to say, oh, they don't go for a pap smear every year. What do you mean? Right. No, they literally don't go ever in their whole lifetime. And so something that's so simple for us, which is a 2-minute procedure, develops into debilitating and mortality related cancer. So that's kind of why we've chosen to do our work mainly in the developing world, because it solely is about access, and with access you can get closer to equity.
And even Marissa, it comes even to so much more basic than that, right? Just even, dental hygiene,
Totally.
right? It's just non-existent. But I also have a question for you, Marissa.
Well, all right, better be quick. We got to wrap it up.
It's twofold. One is you've had a wonderful turnout on your call today. How can people that are listening in, what can they take away if they so desire, to get involved or to help? That's my first question. My second question is, in your strategic, vision moving forward, how can this become quite contagious? Do you have any kind of, ideology set out, to create ambassadors, that can help you, and almost build a succession plan for the people that are working with your equipment, the technicians, the educators, the doctors there, do you have any plans on what the future looks like for you?
I mean, these are both of my 2 favorite questions. So thank you. And I didn't even see them, so that's even better. Listen, like people can help and reach out to me and reach out to our team at HER.Talks.org. We obviously are always, as a nonprofit, we're always raising capital, but we're also always looking for, in some of these corporations, in these hospitals, we're looking for partners. We're looking for partners who want to support what we do, but we also want, equipment partners or technology partners or logistics partners. Like, we can't do this ourselves. And so that's one of the ways. And then as far as ambassadors, we would like everybody to be an ambassador, ambassador to what we do, how we do it. I don't want to be the only organization, that's working the way that we are. And so we want people who are in companies really to be our ambassadors internally and fight with the corporations to say, this is important for us to focus on. How can we help them do their job, which makes us also look really great? And so it's a double-sided, coin when we talk about ambassadors. So there's ambassadors within the companies. There's ambassadors just kind of spreading what we do, and it talks a lot about excess equipment, excess medical equipment. And there's so much just general excess in this world. And so, we fight it for women's health equity and women's health specifically. But, you talk about climate change, you talk about, excess CPGs, you talk all of this. These are just excess. So how do we repurpose this excess and get it to where it needs? And I'm not saying moving trash to somewhere else. That is absolutely not what we're talking about. How can we move things that are perfectly good here to somewhere else who needs them before they wind up in the trash? So it kind of talks to the circular economy. We don't need to throw it in the trash. Let's make it usable and repurpose it somewhere else. And then the topic of, ambassadors in these companies and countries that we work in. So we're always with them. We are, constantly in contact, but we want that they they realize that there's better ways to do this other than philanthropy. And that's one of the reasons we changed from a traditional nonprofit to a social enterprise, is that there needs to be ownership in each of these clinics, in each of these doctor offices, in each of these hospitals, in each of these government areas, that there has to be ownership internally to make the change. There's not a doctor in this world that doesn't want to help people. There really isn't. And they need the equipment and the materials and the supplies to do what they do best. But I think we need to help them get there and also help them have a voice. So when they know that they're making an impact, they're able to talk about that, which then gives them a leg up. It's almost like an investor, or a company that's with investors. Once you have some traction, you can fight for more. You can ask for more. And same thing with these physicians. Once they've had some great traction, they can then go ask the government to say, hey, this is working. How about we do more of this? And it's a proof point. So thank you. That's a great question. We are just out of time because I can keep talking to you guys forever. But what, and of course there's fire engines going down my street, but I just wanted to ask you guys, you know, some final thoughts, some key takeaways, some calls to action for anybody listening to this now live and or also in our recordings. You know, what can people do? I mean, Donna, you asked for mine, so I'm going to ask for all of yours. What can people do? Like, what's the call to action for us to have health equity?
I'd say think bigger. You know, this time that I've spent, you know, with you over the course of the last few days and this webinar has really, you know, opened my eyes and expanded my horizons, if you will, to the idea of global health disparities with women. And so that's where it starts. You have to think a little bit outside of yourself and your immediate surroundings and situations and be intentional about that and be intentional about understanding what is happening in these other countries and be intentional about finding ways to get involved. I mean, I appreciate Andy for reaching out to me, but I was very intentional about participating today because I wanted to learn more about this very specific topic. So it starts with that intention of wanting to know more.
That's great. Mitzi, Donna?
So I'll start out with, again, just very selfishly, I'd like everybody who's listening to think about how they're going to take care of themselves first, because we as women don't usually do that very well. And if we don't, then we can't take care of others. And especially during this pandemic, so many people have not gotten their healthcare checks that we do have access to. And so I would hope that people take advantage of that, because there's a very big concern that we are going to see a lot of later stage cancers that have not been detected. And also the ACA is being expanded, and that will increase access. And so to take advantage of that. And then once somebody takes care of themselves, start looking at opportunities to do more. And I'll echo what Stephanie says in terms of thinking bigger, and especially those entrepreneurs that are doing innovation, to think about how their work could be translated to not just the United States, but to other places or even less resourced places within the United States. And there are venture groups that are looking at taking that kind of technology and translating them to more developing countries. And so I'm hoping that there will be more of those kinds of organizations as well.
And just very quick on closing, Mitzi, you said something that really resonates with me. And I always think of it as being a passenger on an airplane. If the plane goes down, you have to put your oxygen on yourself first before you can take care of others. So maintaining our own health care, I think, is really critical. But for me, you know, with so many years, you know, in the CPG space, my advice is network, right? Because there's usually always a person in arm's length that can connect you with somebody. And just being in procurement, I can assure you that when I walked into so many corporate offices, there was always a room that was filled with excess equipment. Somebody didn't get around to having it picked up, and then the warranties wore off, and they were like, you know what, we'll just get rid of it. And it was perfectly fine, maybe 2 years old, maybe 3 years old. And it's that, you know, network of, you know, reaching out to companies and procurement to say, what is your policy, you know, on equipment? You know, so looking at that with manufacturers or hospitals or, you know, healthcare facilities, I think, you know, you probably have a wonderful opportunity just with many people who just listened today to expand their network to you.
That I will take, because all of, you know, any equipment that we can get, you know, that focuses on women's health, you know, maternal health, diabetes, heart disease, cancers affecting women, like we will we will take it and literally save people's lives. So Donna, don't worry, we'll be networking. Thank you, ladies, so much. Thank you all for joining us as well. Actually, our next Talk is in April. We do this as a monthly series, and we're going to be discussing how the environment impacts healthcare around the world.
One sec, I didn't get that. Could you try again?
Oh,
Was that me?
Siri.
that might have been your Siri.
I'm so
But anyway,
sorry.
no, that's okay. I was just going to say, honoring Earth Day. We're honoring Earth Day, so next month. So we're just going to talk about how the environment impacts healthcare around the world. And I know that's a really important topic that everybody's really looking at. So I appreciate everybody who's been with us, for you ladies on the phone. And thank you so much. We've had so many great comments coming in, so we're excited about it. And I know we always get a ton of people listening. So so afterwards, because it's always so hard to tune in during the workday. So thank you, and everybody have a great day.
Thank you very much.
Have a great
Bye-bye.
day, everybody.